Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about arthritis in your joints. Joint arthritis is the number one leading cause of disability in America, with over 50 million Americans being affected. It involves inflammation of one or more of your joints, with the main symptoms being joint pain and stiffness, and this typically gets worse with age. There are two main types of arthritis, which is osteoarthritis and rheumatoid arthritis. Osteoarthritis involves wear and tear of your joints. It's known as DJD, degenerative joint disease, which is where cartilage breaks down. Rheumatoid arthritis is an autoimmune disease which targets the linings of the joints first. And then there are quite a few lesser causes of arthritis, including psoriasis, lupus, crystalline, which is gout. Why does arthritis occur? Well, osteoarthritis becomes a simple ratio problem. As we age, we continue to make cartilage just like we did decades before. Okay? The problem? You're losing it faster than you make it. It just is what it is, and that's how osteoarthritis forms. Okay? It's a ratio problem. Rheumatoid arthritis is not a hereditary issue. It's women greater than men. Immune system is basically making antibodies against the tissues in one's own body. Risk factors for arthritis: family history, increasing age, females greater than males for rheumatoid, males greater than females for gout, post-traumatic arthritis, and then the one that's not showing is obesity, which is a major risk factor for arthritis. The symptoms of arthritis will range according to what type of arthritis a person has, but typically it's pain, stiffness, swelling, decreased range of motion of the affected joint or joints. Treatment options, there are quite a few. So the main one is activity avoidance. If you're doing an activity such as jogging and it's very painful for you, maybe due to arthritis, maybe you should switch to swimming or cycling. If you're playing golf 6 days a week and it's painful, or tennis, then maybe you should switch to 3 days a week. Okay? Medications may include oral or topical medications for arthritis. This could include over-the-counter, or for short-term exacerbations, maybe some narcotics. For rheumatoid arthritis, there are some disease-modifying agents, which is not really worth going into right now. Bracing can help a lot, as well as canes. A cane, for instance, can decompress the joint of over 50% of the stresses going through it by just simply using it during walking, for instance with the knee or the hip. Physical therapy, chiropractic treatment can help strengthen up the tissues and muscles around the joint, taking pressure off of it and relieving pain. Acupuncture and TENS units can be beneficial as well. Interventional treatments for joint arthritis may include steroid injections. These have been used for decades successfully for the treatment of joint pain from arthritis. They can be repeated every few months. There are people who say that the steroid itself is deleterious to one's joint cartilage. This has actually not been proven. It was shown in small animals decades ago, and it has not been repeated in either large animals or humans. Hyaluronic acid is also shown to be beneficial. You probably know it by the names of Synvisc or Hyalgan. We actually already have hyaluronic acid in our joints. This actually puts more into it, and it promotes pain relief, and the theory is that it promotes more cartilage formation. Prolotherapy involves simple saline injections, and that can work really well. Regenerative medicine consists of platelet-rich plasma and stem cell injections. These fall into the same category because they can actually help modify the disease process by helping to regenerate some of the damaged tissue and cartilage. PRP is platelet-rich plasma therapy. It involves a simple blood draw. Stem cell injections either involve a bone marrow-derived, a fat-derived stem cells, or the newest is amniotic-derived stem cells. Radiofrequency ablation is great for the spine. This actually deadens the little sensory nerve endings that provide sensation to the joints in the spine, and that can provide anywhere from 12 to 24 months of consistent pain relief. The outcomes for nonoperative arthritis treatment is that the vast majority of patients are able to avoid surgery or delay the need for it. Joint replacements are not meant to last forever. It's a quality of life procedure, and while the outcomes overall are very good, there is a potential for some serious complications or a need for a revision. Success rates with steroid injections, hyaluronic acid, regenerative medicine are over 75%. And with radiofrequency of the spine, the outcomes are over 80%. Topical creams are 83% overall effective for all types of pain conditions. Thankfully, arthritis is not a deadly condition. It never killed anybody. It does turn into a quality of life condition. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.